Hi, thanks for joining us today as we talk about FBN Health. My name is Jody Batesel, and I am the program manager for FBN Health. And I wanted to tell you a little bit about this program. We started it in December of 2018 because our farmer members asked us to look into more affordable options for healthcare. The reality is the average farm family is spending upwards of $30,000 per year on health coverage and healthcare expenses. And we're excited to announce this year that FBN Health is now available in all 50 states. And although you might be hearing a lot about open enrollment in the media and all over the internet, FBN Health, we enroll farms all year long. So not just during open enrollment. We would love to enroll you any month of the year. One of the things that makes us unique as well is that we can enroll groups as small as 2 employees, which can be a husband and wife, all the way up to 200 employees or more. So we can really have solutions for any farm of any size. So with me today, I have my 2 broker partners, Jeannie Cunningham and Jessica Gamblin. And Jeannie and Jessica help our members from the time they inquire through their application. They help with claims issues, and then they work with the renewals, and they are just a great resource for our members to have. And Jeannie and Jessica are here to answer some of the common questions we get about FBN Health. So we have a lot to cover, so let's go ahead and get started. Jessica, I believe we're going to start with you. Can you tell me about the plans that are offered through FBN Health?
Sure. FBN Health offers 4 different plan options. There's a deductible for every budget type. We have a deductible as low as $2,000, and it goes all the way up to $6,500, which is our high deductible plan. The first 3 plans are first dollar coverage, which means when you walk into the doctor's office, you're going to have a copay, and that $6,500 plans means you meet the $6,500 first before the plan will cover anything. All 4 of our plans offer a teledoc service, which is great in this day and age, and preventative services are covered at 100%, and we're very excited about the new ambulance option that we now offer.
So can you explain to me, or maybe Jeannie, maybe you'll take this one, what do you mean by ambulance coverage? Isn't ambulance covered with all health plans?
So yeah, there is definitely a portion of your ambulance costs that are going to be covered with your major carriers, but usually, unfortunately, it's only about 50%. And the other piece of that is most times the insured doesn't even know that that's how it works until it's too late. So in the rural areas, which we cover all over the United States, the opportunity to have to ride an ambulance, unfortunately, could be good for our farmer members. That would be ground ambulance or air ambulance. And what happens is that you're going to be balance billed for the piece that the insurance carrier does not pay. In an air ambulance situation, that could be up to $20,000. And so what we've done is we've embedded into the plan a program called MASSA, and MASSA covers that balance bill for you. So if you're a farmer and you have an accident, you have to take a helicopter ride, you're going to be taken care of, Jody.
So what you're saying is that would be covered at 100%.
Absolutely.
If I had to have an air or land ambulance.
Whatever piece that the health insurance carrier does not pay, then MASSA's going to kick in and pay the balance on that for you.
And that's embedded with all of the FBN Health plans?
It is. It's included in all of our FBN plan health offerings.
Great. So Jessica, can you tell me if I sign up with FBN Health and I have my specific doctor or my specific hospital that I want to go to, will those be covered? Will those be in network, or will I have to go somewhere else?
Absolutely. We are going to work closely with your group to make sure all of the hospitals and doctors that you need are going to be in network. We offer 2 different national networks, First Health and PHCS. So what we're going to do is we're going to plug in your zip code, and we're going to give you a hospital comparison between 30 and 50-mile radius of your area. And then we'll put those on a list for you. And then if you have anybody specific that you don't see on the list, you're going to email those right to me, and we're going to look those up and make sure that you can still see the providers you need to.
Okay, great. So you make sure before they actually sign up that the providers and the locations that they need to go are included.
Absolutely. Yes. That's one of the big key components of all of this, is just to make sure that you can still go where you need to.
Okay. So, Jeannie, I know that you have been working with this program for quite a while. Can you tell me what is new for 2022 that you guys are excited about offering to our farmers?
There's a couple of things. The one that I'm the most excited about, I would say, is our new Catalyst plan. And the health insurance industry has been a challenging one the last 10 years and more. And so what we've built into the new FBN Health Plan offering is an opportunity for you to have a $0 deductible. So the way that works, built into our program, is a managed care option. So if you have a specific issue, if you have a specific thing that you have to get done, let's use a knee replacement surgery, for instance. If you'll use our managed care program and call that nurse, they're going to talk you through this. They're going to steer you and point you in a direction of a hospital or a clinic that you can use. It's not only going to give you best outcome as far as that particular condition is concerned, but also you'll be able to enjoy that $0 deductible. That is really, really exciting for us. It's not a have to. I'll try not to take too much time here, but you can go with your standard plan. And if you pick the $2,000 deductible, you can go to any hospital you want. We're not trying to force you to do anything out of your comfort zone, but this is an opportunity for you to go to a great place, the right price, and bottom line, that $0 deductible for you. That is my number one excitement. Number two is probably going to be the Medicare piece. We have built in a Medicare option that can be embedded right into your FBN group health plan. So if you age in, you turn 65, we can offer you a supplement. That'll include your Part D. Anybody that's 65 knows what a Part D plan is, and that's your drug coverage. And we can build that right into your FBN health plan. So we have a lot of folks that are turning 65 out there, and we want to be able to help them.
So with that Medicare coverage, do I need to have a physical if I'm turning 65 and I want to sign up for that? Is there a
No,
physical
that's a good
required?
news piece. There's no medical questions asked, and that's a guaranteed issue. All you have to do is be 65 and you're good to go.
And do I have to have it as part of a bigger group plan, or can I just be by myself and reach out and get a Medicare supplement?
You can reach right out to us and just get the Medicare supplement. You absolutely can.
Okay, great. One of the questions that we get at FBN Health a lot is, how are we saving people so much money? And, I know from working here that, one of the ways that we're doing that is we're leveraging the power of our network, which is over 24,000 members strong and growing every day. And that's, we've used that number to negotiate some great rates with our carriers. So Jeannie, I think you're the one that's going to answer this question. How are the rates determined for each group? And, will my rates change once I'm enrolled? Am I going to get in at this really low price and then all of a sudden I'm going to have some big shift later on? Can you talk about that a little bit?
I guess rates are the most important question there is. That seems to be the one that everybody is the most interested in. So in this particular case, our rates are medically underwritten rates. We're going to take all your demographics, your birthday, your gender, and then health questions that we're going to gather up. And we're going to send that off to the underwriter and bring you back a 12-month guaranteed issue rate. So we'll bring you the 4 plans like Jessica discussed. We'll show you the range of those plans and the range of those rates. But bottom line, it is going to be based on gender, birthday, and the health conditions in your group.
So will my employees have to have a physical, or how will you be able to know what their health is?
No physical. They're going to complete a health statement, an electronic application. I think Jessica is going to tell us a little bit about that. And again, their rates are going to stay good to go for 12 months. At the 10-month mark, we're going to come back and offer you a renewal option, and you can sign on with FBN Health for another 12 months.
So once I go through the application process and I get my price quote, how long do I have before I need to make a decision? Is that something I can wait just like a week or a few months? Or can you guys explain to me how that works? How long is my rate good for?
Yeah. So once you get that firm final offer rate quote, that quote will be good for 60 days. After that, you do have to update your health applications and go back through the underwriting process.
Okay, so if I do sign up and then it's coming up on my renewal, I know in my past experience as an employer, I might be seeing a lot of rate increases. It seems like that's pretty typical with a lot of health insurance programs. Is that something that this program has as well? Are you seeing a lot of rate increases after the year mark?
So, rate increases, what the insurance carriers tell us is that you need to calculate and forecast for at least 1% per month, Jody. So that's 12%. They're telling us that our cost of living, if you will, increase is going to potentially be 12%. We don't see that with FBN Health because of the numbers. And so what we've been looking at is anywhere from 7 to 9%. But because of the cost of medical care goes up, there's no way that I can bring 0% increases these days anywhere, unfortunately.
Yeah, and I don't think that there are any health insurance companies that are giving a 0%
Not
increase
in a
these
long
days.
time. That's right. That's right.
Yeah. So we're certainly not different in that regard. So, Jessica, if a farm has heard everything we've talked about and they're excited and they want to apply and see if they can save some money, what are the next steps that they need to do and what does that process look like?
Right. So the next steps to apply is you can go to fbnhealth.com and click on get a quote. That's going to kick off the process. After that, you will receive an email from me with further instructions on how to get started and how to get your employees those health applications to complete. Once all of the employees have completed the health applications, I will send it off to the underwriters. We generally get a quote back between 7 to 10 business days. Once we get your quote back, we will get that over to you, and then we can schedule a time to discuss rates and benefits and go over any questions that you may have.
And Jessica and Jeannie, thank you so much for joining me and answering these questions for our members. It's great to be able to offer this program and hopefully save some of our farmers a lot of money on their health coverage. And like Jessica said, if you are interested in applying, go to fbnhealth.com, click that big green button right at the top, and that will kickstart the process. And we are happy to help you any way we can. Thanks again. Have a great day.
Thank you.
Thank you so much for having us.